Today is July 1st, 2026. And if you are one of the 43 million Americans who carry student loan debt, or if you are a student planning to go to graduate school, medical school, law school, or any professional program, today is the day your financial reality changed, permanently, without a primetime press conference, without a national address, without most Americans even knowing it was coming. Because today is the day that Donald Trump's sweeping changes to the American student loan system took effect. And the scope of what changed today, what was eliminated, what was capped, what was restructured, represents the most significant transformation of how Americans borrow money for education in a generation. I want to be direct with you from the very beginning of this video. This is not a story about whether student loan debt is good or bad. This is not a debate about whether college is worth it or not. This is a factual, complete breakdown of what the law now says, what it said before, and what the difference means for real people, students, parents, future doctors, future lawyers, future nurses, future teachers, who are trying to make financial plans for their education and their lives. Because too many people do not know what changed today. And not knowing what changed today could cost them tens of thousands of dollars in decisions they make in the coming weeks and months. So let us go through it completely and clearly, starting from the very beginning. To understand why today's changes matter so much, you first need to understand what the American student loan system looked like before today. The federal student loan system was built on a relatively straightforward principle. The government would lend money to students at interest rates lower than private market rates, under terms more favorable than any private lender would offer, in order to make education financially accessible to Americans who did not have the personal wealth or family resources to pay for college and graduate school out of pocket. This principle, federal loans as an equalizer, a tool to make education accessible across income levels, has underpinned American higher education financing for decades. The system had problems. Student debt levels had grown to crisis proportions, with total outstanding student debt in the United States exceeding $1.7 trillion. Repayment rates and default rates indicated that millions of borrowers were struggling to manage their loan obligations. The system needed reform. Very few people disputed that. The debate was always about what kind of reform, who would be affected, and whether the changes would make education more or less accessible to the Americans who need it most. What the Trump administration has done, effective today, is implement a reform that restructures the system in ways that are significant, immediate, and in some cases irreversible for the students who are making educational decisions right now. Let us start with the most immediately significant change. The elimination of the Grad PLUS loan. The Grad PLUS loan was a federal loan program that allowed graduate and professional school students to borrow up to the full cost of attendance for their programs. It covered tuition, fees, living expenses, and other education-related costs that the standard federal Stafford loan limits did not cover. The Grad PLUS loan was specifically designed to fill the gap, the space between what standard federal loans provided and what graduate education actually cost. For decades, this gap-filling function was what made it possible for students without wealthy families to attend the most expensive but most career-transforming graduate programs in America. As of today, that program no longer exists for newly enrolling students. The Grad PLUS loan has been eliminated. If you are a student who planned to use Grad PLUS loans to finance your graduate education, and you have not already enrolled and borrowed under the old rules, you are now operating under a completely different system. Let us be specific about what replaces it. Graduate students can now borrow a maximum of $20,500 per year in federal loans and a maximum of $100,000 over their entire graduate career, $20,500 per year. To understand why this number is insufficient for most graduate programs, you need to look at what graduate education actually costs. Let us go city by city and school by school. A graduate student at New York University faces a cost of attendance, tuition plus living expenses, that can exceed $65,000 per year for many programs. $20,500 in federal loans covers roughly 31% of that cost. The remaining 69% must come from somewhere else. A graduate student at the University of Southern California in Los Angeles faces similar numbers, Cost of attendance above $55,000 per year for many graduate programs. Federal loans cover less than 40%. A graduate student at Boston University, at Georgetown in Washington, D.C., at the University of Chicago, the same story. Major universities in major cities where significant proportions of America's graduate talent is trained. Federal loans under the new system cover a minority of actual costs at virtually every one of them. This is not a problem that affects only elite institutions. The same math applies at state universities in high-cost cities. It applies at second-tier programs where students go specifically because their families cannot afford the most expensive schools. The $20,500 cap is not just below the cost of elite education. It is below the cost of most graduate education in most American cities. Now let us focus on the change that will have the deepest and most lasting consequences for American society: the new borrowing limits for professional school students, medical school, law school, dental school, veterinary school, nursing programs, social work programs. These are not abstract academic pursuits. These are the professional pipelines that produce the doctors who treat you, the lawyers who represent you, the dentists who maintain your health, the social workers who support vulnerable families. These pipelines are where today's changes will be felt most acutely and most consequentially. Professional school students can now borrow a maximum of $50,000 per year in federal loans, and a maximum of $200,000 over their lifetime. $50,000 per year sounds like a meaningful amount, until you look at the actual numbers. The average cost of attendance at a U.S. medical school, tuition, fees, and living expenses combined, is approximately $60,000 per year, according to education research data from the Association of American Medical Colleges. Not the most expensive programs, the average. The new annual federal borrowing cap for medical students is $10,000 per year, below the average cost of attendance. Over 4 years of medical school, that is a $40,000 gap that every medical student must fill from non-federal sources. At more expensive programs, at private medical schools in major cities where costs can approach $80,000 or $90,000 per year, the gap is far larger. $30,000, $40,000, $50,000 per year that must come from private loans, family contributions, savings, or some combination. And private loans for medical students do not carry the same protections as federal loans. They do not offer income-driven repayment options. They do not offer the same forgiveness provisions. They do not offer the same deferral protections if a borrower faces hardship during residency, a period when doctors are working extraordinarily long hours for salaries that, while not insignificant, are far below what practicing physicians earn and far below what the debt burden accumulated over medical school requires to manage comfortably. The law school picture is similar. Average law school cost of attendance runs between $40,000 and $70,000 per year, depending on program and location. The new $50,000 federal cap covers the lower end of that range, but for the programs in the cities where most legal careers are built, the gap is significant. And for the students who attend law school with the intention of going into public interest work, public defenders, legal aid attorneys, civil rights lawyers, nonprofit counsel, where salaries are far lower than corporate law, the additional private loan burden that today's changes create will make those career paths even more financially precarious than they already were. Nursing programs present a particularly acute problem. Nursing education is already one of the fields most severely affected by a national workforce shortage. The United States is projected to face a shortage of up to 360,000 registered nurses by 2030. One of the documented factors limiting nursing workforce growth is the financial barrier to nursing education, particularly for advanced practice nursing programs like nurse practitioner and nurse anesthesiology tracks, which require graduate education and whose graduates provide essential healthcare services, particularly in underserved communities. Today's changes add to that financial barrier. They do so at precisely the moment when the nursing shortage is most acute and when the pipeline of new nurses is most urgently needed. Social work programs, which produce the professionals who work with children in foster care, with elderly adults in need of support, with people experiencing mental health crises, with families navigating domestic violence, are also affected. Social work salaries are among the lowest of any graduate-level profession. Social workers make enormous contributions to society for relatively modest financial compensation. The students who enter social work programs do so knowing this. They are not making a financially irrational choice. They are making a values-based choice to prioritize contribution over compensation. Today's changes make that values-based choice more financially punishing, because the gap between federal borrowing limits and actual program costs that must now be filled by private loans will fall disproportionately on the graduates whose earning power is lowest, and social workers are consistently at the lower end of the earnings spectrum for graduate-level professionals. Let us now talk about who specifically will be most affected by these changes, because the impact is not evenly distributed across the student population, and understanding who bears the greatest burden matters for understanding what these changes actually mean for American society. First-generation college students. Students who are the first in their family to attend college or graduate school carry a specific set of financial vulnerabilities that make today's changes particularly consequential for them. They are less likely to have family members who can provide financial support to bridge the gap between federal loan limits and actual program costs. They are less likely to have family members who can co-sign private loans, which matters because private loan interest rates for borrowers without strong co-signers are significantly higher than for those with established family credit. They are less likely to have the financial safety net that allows a student to take on additional private debt with confidence that family support exists if repayment becomes difficult during the early post-graduation period. And they are disproportionately represented at exactly the kinds of programs, graduate programs in fields like education, social work, public health, and nursing, where the combination of significant program costs and modest starting salaries makes the financial math of additional private loan burden most precarious. Students of color. The demographics of student loan borrowing in America reflect long-standing wealth inequities. Black and Hispanic students borrow at higher rates and in larger amounts relative to family income than white students, because they are less likely to have family wealth available to supplement federal loan borrowing. Today's changes, which require students to either rely on family wealth, private loans, or forego graduate education, will disproportionately affect students from racial groups where family wealth is, on average, significantly lower due to the documented history of wealth exclusion and extraction that has shaped economic outcomes across generations. Students in rural communities. Rural America faces a specific healthcare crisis, a shortage of physicians, dentists, and other healthcare providers that leaves rural communities with inadequate access to medical care. One of the documented strategies for increasing rural healthcare provision is training students from rural backgrounds for healthcare careers, because healthcare professionals who come from rural communities are statistically more likely to return to practice in rural areas. The students who come from rural communities and want to enter healthcare professions are precisely the students who are least likely to have significant family wealth available to supplement federal loan limits, and therefore precisely the students who will face the greatest barrier from today's changes. The cruelty of this specific dynamic is that it reduces the pipeline of healthcare professionals for the communities that are already most medically underserved. Now let us be fair and present the administration's case for these changes, because understanding the reasoning behind them is important for evaluating whether that reasoning is sufficient to justify the consequences we have described. The administration's central argument is that the federal student loan program had become a mechanism for colleges and universities to extract enormous tuition revenues without accountability, because students could always borrow more from the federal government to pay whatever tuition universities chose to charge. The argument is that removing the unlimited borrowing that Grad PLUS represented will force universities to reduce costs, or face reduced enrollment as students decide that programs whose costs exceed the new federal borrowing limits are not worth attending at the price universities are charging. This argument has some economic logic to it. When buyers have access to essentially unlimited financing, sellers have less pressure to control prices. If federal borrowing limits cap how much students can borrow, Universities that want to maintain enrollment will face pressure to bring their costs within the range that students can finance. This is the mechanism the administration is relying on to produce the tuition reduction it says will ultimately benefit students. The problem with this argument, the reason critics say it will not work as the administration claims, is that the time horizons are completely different. University cost reduction, if it happens at all, will take years or decades. The tuition pricing decisions universities have already made for the 2026 to 2027 academic year are fixed. The curriculum and staffing decisions that underlie those pricing decisions are made years in advance. A university cannot reduce tuition by 20% next fall in response to today's federal borrowing cap changes. The students who are affected by today's changes are affected today, not after the market adjustment the administration is counting on has had years to work. This means there is a period, potentially a long one, during which students face reduced federal borrowing without the tuition reductions the administration's model predicts will follow. During that period, those students must absorb the gap through private loans, family contributions, or reduced enrollment. The administration has not provided a clear answer for how students in this transitional period are supposed to manage, and the transitional period is now. It started this morning. Now let us connect this to the broader pattern of this week's news from Washington, because the student loan changes do not exist in isolation, and understanding them alongside other decisions happening simultaneously reveals something about how this administration governs. This week, NBC News and multiple other outlets reported that Trump has been attaching political campaign endorsements to official federal disaster relief announcements. When he approved $32 million in federal disaster aid for Michigan, he included explicit endorsements of Republican candidates running for office in Michigan. When he approved $8.6 million for Louisiana, he named and endorsed specific Republican politicians. Disaster aid, which is a non-discretionary government function required by law when certain conditions are met, was turned into a vehicle for political messaging. This is unprecedented in 47 years of FEMA history. No president of either party has ever done this before, according to NBC's reporting. And Politico documented in March 2026 that this administration has rejected disaster aid for Democratic-run states at the highest rate in FEMA's history, while approving aid for Republican-leaning states at higher rates. The connection to the student loan story is not that these are the same policy area. The connection is the pattern. Federal programs that affect millions of Americans, student loans, disaster relief, healthcare, are being restructured and administered in ways that consistently produce outcomes aligned with partisan political calculations. The student loan changes disproportionately affect graduate students in major metropolitan universities in large cities, places that vote Democratic at high rates. The disaster aid pattern shows money flowing toward Republican-leaning states and being withheld from Democratic-leaning ones. Whether each individual decision can be justified on its own policy merits, and reasonable people can debate that for each of them, the pattern of outcomes across multiple major federal programs is consistent and documented. Now let us talk about what you should actually do if you or someone you know is affected by today's changes, because this video is not just about informing you, it is about giving you a framework for navigating the new reality. If you are currently in a graduate or professional program and borrowed under the old rules before today, your existing loans are not affected by the new caps. The new limits apply to newly enrolling students. Current students retain access to existing repayment options until July 2028, giving you time to understand the RAP and other new options without immediate forced transition. If you are planning to start a graduate program in fall 2026 or later, you need to do the financial math under the new rules specifically. Do not assume the financial model you built based on Grad PLUS availability still works. It does not. You need to know the new federal annual cap for your program, $20,500 for standard graduate programs, $50,000 for professional programs, and calculate the gap between that and your actual cost of attendance. You need to research private loan options, understand the interest rate difference between federal and private borrowing, and factor in the long-term cost of that interest rate difference over a typical repayment period. You need to ask your program's financial aid office specifically what options are available for bridging the gap under the new rules, because programs that want to maintain enrollment will be under pressure to provide information and potentially additional institutional support. If you are a family member trying to understand what these changes mean for a son or daughter planning graduate school, the key number to focus on is the gap between the federal borrowing cap and the actual cost of attendance at the specific programs your family is considering. That gap is the new financial planning challenge that did not exist in the same way yesterday. And if you are a young person who is in high school or early college making decisions about whether to pursue graduate education, the fundamental question you need to ask is whether the career path you are considering will generate enough income in the early post-graduation years to manage the combination of federal and private loan debt that the new system will require. For high-earning professions, surgery, certain legal specialties, certain technology fields, the math may still work even with additional private loan burden. For lower-earning professions, teaching, social work, public health, primary care medicine in underserved areas, the math has become harder, much harder. And the fact that the professions where the math has become hardest are also some of the professions where America most urgently needs more people, more primary care physicians, more mental health professionals, more teachers, more social workers, is the deepest tension at the heart of today's changes. The United States faces documented shortages in virtually every profession, where today's federal borrowing cap changes make financial planning most difficult. This is the world that July 1st, 2026 has created, a student loan system fundamentally transformed. 43 million Americans carrying existing debt under terms that are now in transition. Millions more making educational decisions under a new set of rules that most of them do not yet fully understand. A private loan market that will now capture the demand that federal borrowing no longer serves, at higher interest rates, with fewer protections, and with consequences that will not be fully visible until the repayment phase begins years from now. The administration has made its case for why these changes are necessary and will ultimately benefit students and society by forcing university cost reductions and establishing a more sustainable federal loan system. Critics have made their case for why the changes will cause immediate harm to the students who can least absorb that harm, while the long-term market corrections the administration is counting on may arrive too slowly or incompletely to offset the damage. The debate will continue. The changes are real, immediate, and effective as of this morning. What you do with that information, as a student, as a parent, as a voter, as a citizen, is your decision to make. And making it well requires understanding exactly what changed today, who is affected, and what the new landscape actually looks like for the real decisions real people are making right now. I am here to make sure you have that understanding. Subscribe for daily coverage of the decisions that are changing your world. Hit the bell, share this with everyone who needs to understand what just happened to student loans in America, and we will see you in the next one.